In order to re-establish or improve range of motion, simple stretch movements are recommended. Here we have the patient doing a heel prop exercise. For this exercise, roll up a towel and place it under the heel of the injured leg. Get the patient to alternate between slight flexion, holding this position for 10 seconds, and a relaxed position. Do 3 sets of 10 repetitions, allowing for 2-minute breaks in between. The progression for this exercise involves using the towel for active resistant stretching. The second range of motion exercise is a heel slide. Get the patient to lie on their back with their knees at a 45-degree angle. Have them slide their heel towards their body. Hold this position for 2 to 3 seconds and slide the foot back to the original position. The progression for this exercise again involves the use of a towel for active resistance stretching. For both of these exercises, 3 sets of 10 repetitions, holding each stretch for approximately 10 seconds, is recommended. The final exercise for increasing range of motion is the bicycle. Get the patient to do bicycle movements, ensuring that the patient is able to do both forward and backward movement. Try to ensure as much range of motion is being achieved as possible. We recommend starting with 3 sets of 10 repetitions, taking 2-minute breaks in between. Each range of motion exercise presented in this video should be performed at least twice a day. In order to re-establish or improve overall strength, it is recommended to progress from isometric exercises to isotonic exercises, and then finally isokinetic exercises. It is essential to concentrate on strengthening all of the muscle groups that have some function at the knee joint, including quadriceps, hamstrings, and the gastrocnemius. The first exercise is straight leg raises, beginning with leg raises for hip flexion. For flexion, you should instruct the patient to lift their injured leg and bring both knees into alignment. Next, proceed to straight leg raises for hip abduction. Get the patient to lift their injured leg away from their body to a point where they are still comfortable without pain, while still maintaining a stretch. Next is straight leg raises for hip extension. Again, instruct the patient to lift their injured leg as far as possible without any discomfort, while still maintaining a stretch. And finally, straight leg raises for hip adduction. The same instructions as hip extension and abduction apply to this exercise. 3 sets of 10 repetitions with a 2-minute break in between is recommended. The following exercises are isotonic, encompassing both eccentric and concentric muscle contractions. The first exercise is a wall slide. Get the patient to lean up against a wall and slowly slide down the wall into a half squat position. The patient should not exceed a 45-degree angle at the knee, and their feet should be far enough away from the wall so that their knees are not over their toes at any point in the exercise. The progression for this exercise is a mini squat. Again, the patient should not exceed 45 degrees, and their knees shouldn't go over their toes. The final progression for this exercise is identical to this one, except for without the use of a prop. 3 sets of 10 repetitions with a 2-minute break in between is recommended for each of these exercises. The final strengthening exercise is an isokinetic step-up exercise. A step board is needed to perform this action. Get the patient to perform the action shown in this video, standing with their injured leg closest to the stepping board. Hold the pose at the top of the stepping board for 2 seconds. Add extra height to the stepping board as a progression. It is recommended that the patient performs 3 sets of 20 repetitions with 2-minute breaks in between. In order to re-establish or improve proprioception, weight-bearing exercises are recommended. Here we have the patient doing a one-leg stand. Start the patient off with a chair for balance. The eventual goal is to have the patient be able to stand like this without a prop for support. During initial rehabilitation, hold this position for a minimum of 20 seconds, working towards a final goal of at least a minute. Once the patient has mastered this, have them repeat the exercise with their eyes closed. This next exercise involves active movement. Get the patient to balance on their injured leg while moving their uninjured leg across and behind their body. Once the patient is comfortable with this exercise, get them to try it with their eyes closed. This final proprioception exercise requires the use of a wobble board. Using a chair or wall for stability is recommended. To begin this exercise, get the patient to balance on the board with their feet shoulder width apart. Try holding this position for 20 seconds. Once this is mastered, move on to the next progression. Get the patient to move their feet closer to the middle of the wobble board to make it more challenging. The final phase of this exercise is balancing on the wobble board with one foot. This should only be used once the patient is completely comfortable with the first two progressions. These exercises should be performed for a minimum of 20 seconds with a 2-minute break in between. We recommend performing proprioception exercises for at least 20 minutes a day in bouts of 5 minutes or more. Don't forget to switch feet.